Okay, this is going to be me, and if I want to add somebody, I will do it. So don't worry, it's quite personalized. You stand this way first. Let me see how it goes. Go this way. No, no. Please keep that space for Mom Patricia when she's here. I think I'm a little bit far and I'm not putting on my mask. What should I do? Let it stay. Okay. So go ahead. Now, when you start, whatever you want to start, just make sure you are starting from the first thing. When you get into the hospital, the first thing you do is hand over. Whether you are a doctor, whether you're a nurse, whether you're an auxiliary, whoever you are, when you get to the hospital, you take over. Because you need to know what happened, to know where to continue. And if you miss that part, going forward to do what you are supposed to do becomes wrong. You have to change, you have to adjust oxygen. Under what basis? You have to change the patient or tell the patient what is the protocol for that patient. You have to do feeding. What is the protocol? What was done? What is new? The new patients, how are you going to know the new patients? How are you going to know what happened from what did not happen? You understand? So it is very important for you to start right. Now I want you to take it all over again and give me the steps. When you are in the hospital, during your duties as an ICU nurse, what do you do?
First, I got handled from the bleeding side, and then I went to the patient side and checked for the patient side trolleys and medications, whether they are give or not. The trolleys will be neat or like that. And if patient is conscious and oriented and is able to speak, means I ask the patient and greet the patient. How are you? Or how was the last night? Or how you feel right now? Like that. And check the vitals, which is in continuous monitoring. So I check whether it is correct, and whether I check for the patient if he is having any oxygen or any supportives or contractions like catheter.
Any contractors? Okay.
And IV line is secured or not. Fluids is what fluids is going, and he is on catheter or cephoiding. He is on oral diet or any NG tubes like that.
Okay. What else?
And after that, I have to check the patient with head to toe by any. If patient is prolonged, means I have to check any bed sores or like that. So I will tell the patient and see for any bed sores, and ask the patient if you have any complaints, means tell me like that. And attend the doctor's rounds meanwhile.
Okay.
And feed the patient.
We have rounds. You said feed the patient. Okay, anything you want to add? Anything you want to add? Please, you have a seat that has been given to you that way. Why? We are keeping you safe.
Me or Grace?
No, you. Okay, anything you want to add? You said during your duties as an ICU nurse, you do handover, you do greetings, you do vitals, you check contractors, and you do assessment, you do rounds, and meeting of daily needs. Okay, that is feeding. Now, did you see the difference of what I have said and what you said? I have spoken like a medical personnel. I've spoken like a nurse. You were talking like a layman. Did you see the difference? She said, I do handover, I greet, I go check vitals, I see if the patient has bed sores for long-term patients, I follow the doctor for rounds, and I feed the patient. I have put the same thing you said in another word, but in medical terms. And this now makes you differentiate from being a nurse, a civilian and a nurse. Not saying that nurses are not civilians, but I'm just differentiating from by profession. And if you get to the hospital, you do handover, you go for rounds, like you're greeting the patients, you go for doctor's rounds, taking handover, practically taking handover to see your patients and to see their conditions, what was said, what you are seeing, and what you will do. Because what the nurse said before, we have gotten situations where they read the report and they tell you the patient slept well, everything is okay, medication said, no new complaint, patient is healthy and ready for discharge. And then we go to the bedside and the patient said, I did not sleep since 2 days ago. And I have been given the complaint and the nurse did not do anything. But according to the report, it says the patient is ready for discharge. Okay? Now all these things you are gathering are what you are now going to do, your planning, which I did not hear from what you said. Because you did not put it the way I put it. You did not give me the purpose for you to take reports. The reason why you are taking reports is so that you can gather that report, you check the present need of the patient, you come out with your care plan, and then you go ahead to execute. Is that understood? Now, what is the purpose for this exercise? I want you to be completely relaxed. I want you to be completely free. I want you to understand that firsthand you have been doing this. And the process for competency is the same thing you have been doing. The only difference is maybe in the language. We said the same thing, but in 2 different languages. Okay? So it should not come a time where you ask a question and you get into fright. Just explain to them what it is. Now, can you remember the questions they asked you during your first competition? If you remember, can you identify the positions you went wrong? Have you evaluated? So where did you go wrong precisely? Where? At which point? What was that question? She is so carried away. You are so pretty and so petty at the same time.
I know. I show on the screen because I cannot see myself.
You cannot see yourself, but yes, when you are looking, I see you. And you make me now look like I'm night while you are light.
No.
Yes.
You remember I'm paying money to become like you. Right? You
By
remember?
buying cocoa and Vaseline. That is what she means. That when she gets cocoa Vaseline, she now becomes like me.
I wanted to buy Vaseline, so I put it next to Aisha, and then I removed it. I got the one that is on cocoa. I put it next to her hand. I said, if I buy this, I can become like your skin. It will make me like you. I will buy this. And I got it.
And when
But unfortunately, I'm still.
nobody sees when she bullies me, everybody sees only when I bully her. That is why I'm the villain, yeah. And she's the good person. And they wonder why I keep sending her to hell every day. Okay?
I'm not going to hell alone.
Yes, you go with me. I know. So you see, which question did the assessor ask you that you think was the reason why you failed your first competency?
In tracheostomy.
In tracheostomy, yes. So what was about the tracheostomy?
They ask, they give the gurgling sound, which the secretion is there. But I do suction, but don't decup.
You did not
Did not decup.
deflate. Okay. I am glad that you identified where the problem was. Because why was it necessary for you to deflate?
Still the secretion is there because if we decuff means the secretion will come out.
Okay, now see. Was the problem the secretions? Or was the problem the fact that the tracheostomy was dislodged and was blocking the trachea? What was the problem?
No.
It was not the secretions. This is what I see. When you want to correct something, you don't correct by learning new things. You correct by first of all identifying where the problem is and then taking it from there to learn new things. Voila. Even hellfire is not for you. We'll get somewhere. We'll put you. Okay, so tell me, don't mind. Don't mind, I know how to deal with her. So, you see where the problem is? If you did not identify that problem, you might make the same error. They will just trick you for the same thing but change the question. Are you understanding?
The problem is when she was,
Yes.
then when she was,
Good morning. Your name is Abraham. Okay. Someone will open the door.
Jackie, open the door.
Jackie, please open the door and bring me the document.
So what happened during competency, when he gave you gurgling sounds, you just assume this is normal, ordinary secretions, and you did not try to identify what is the real problem behind this gurgling sound. So you dealt with it as if it is just secretions. You suctioned very right. You did hyperventilation before and after. You maintained infection control. Everything was under control. But this was just the pure scenario that I gave you here before you went to competency. So it was when I came and I asked you, can you please go ahead and practice suctioning? So you went and you practiced suctioning very well. And you did oral and you did endotube suctioning. But in competency, it is not only about the skill itself, it's about identifying what's wrong with your patient. So what you did in competency, you ignored the gurgling sound. This is one sign that you did not take into your analysis. This is why I always tell you, you have to do your analysis. You gather your symptoms. Yesterday I told you highlight and red, right? So that you identify where I need to focus. So when you were in competency, you ignored this one sign that is very important. That's why you did not identify what happened with the patient. So you went in, you suctioned, you went out, you hyperventilated, and then he told you the sound is still there. You said, I will suction again. So for the second time, he gave you hint, and you decided to give oxygen and suction, and that's it. In competency, every word that the assessor is telling you is guiding you somewhere. He wants you to go somewhere. He is opening a new scenario for you to see how you will deal with it. So take into consideration every sound or every sign or every assessment result or finding that they will give you. This is one. Second, do you think this is the only reason why you failed? Because Aisha asked you, what happened, why did you fail? So you answered tracheostomy, right? So do you think that was the problem only? What was the problem also?
They asked CVAs.
What is the difference between ischemic stroke and hemorrhagic stroke? So can you identify now what is the difference? Go ahead.
Ischemic stroke is a blood clot in the arterial blood vessels in brain. Hemorrhagic stroke, it is a rupture of the artery in the brain.
Ischemic stroke is the rupture of the vein.
Ischemic is a blood clot. Blood clot that blocked the brain.
Which vein?
Artery. Cerebral artery.
In the brain.
Yes.
Not any vein. Not in your leg, not in your heart. You mentioned coronary artery in competency. He asked you which artery, you said coronary artery. Because you were so stressed. You yourself don't know that
Don't remember.
you don't know that you
Because
answered this way.
she looks like what I talking about.
When she said coronary artery, I was like,
Okay.
okay, hello.
Now this is it.
Okay, so number 3, other than ischemic stroke and hemorrhagic stroke, I don't think that hemorrhagic stroke was the reason or the huge mistake. I believe that you were not able to control your anxiety. You were so anxious so that you said coronary artery and you don't know that you said it. Okay? So you cannot allow your anxiety to take over for the second time. You already passed through competency. You already know what it looks like. You know how the assessor will ask you questions. You're ready for me being sitting here, cannot answer any question, cannot help you, cannot do anything except for yes and no. And then when I started talking, he said, do not talk. So you're used to this. You overcame this barrier. Tomorrow, there's no place for anxiety to take over. No place. This is your last chance, and you will come here, prove your skills, your knowledge, and how competent you are. Okay? So for me, it was not hemorrhagic stroke and ischemic stroke.
Ischemic
That was
stroke.
not the problem. The problem that was you were not able to explain yourself. Everything is confused in your brain because your heartbeat, I was able to hear and feel your heartbeat from here. This is okay. You were so scared, but tomorrow we will learn from what happened last time. We're not gonna repeat it, okay? And tomorrow when you feel anxious, don't say that it's coming again to be the same like what happened last time. Don't get a flashback in your brain that tomorrow or today I will repeat also the same and I will not be able to speak. No. Control your anxiety and say, I allowed my anxiety to take over last time, I will not allow it this time. I know it and I'm going to show that what I know is correct. Okay? This is second. One more thing is, what else do you think also for the question of Aisha was failing you?
What else?
No, that's not it. What did you go outside and did you read about? Mechanical ventilator. You are an ICU nurse, you don't know why we use mechanical ventilator? You know. I know that you know. So explain to me now.
Mechanical ventilator. It is used for critically ill patients. It is not.
What does it mean critically ill patients? This critically ill patients, I can see it on Google. For people who are not from the medical field, which cases we will use mechanical ventilator for them? COPD? Why did you say COPD? Have you ever found in your ICU unit a patient who was admitted to your unit and put on mechanical ventilator just because he has COPD? Never. So why did you tell him COPD? Go ahead.
Respiratory failures.
Yes.
Respiratory failures and cardiac failures. Then any post-surgery or neuro patients.
Yes, what else?
Then this one.
Yeah, you know more. If a patient bleeds to death in the OR, what we call this?
Cardiac arrest.
La, bleeding is what? Before they arrest, they will go through what?
Unconscious.
If a patient starts bleeding, before they get to the stage of arrest, what do they go through? See, when I started the exercise, I wanted you to be completely free. I wanted you to be relaxed. This is me trying to bring you from this place back to India into your world where you move feel free and you are the boss. Okay? This is what I want you to feel. Because when you feel that safe, you'll be able to handle your questions with ease. These are not questions you don't know, they are questions you know. If somebody is bleeding, before they get into the cardiac arrest, what would they go through? What is the first stage they will first go through?
Decreased GCS.
Due to what?
Due to hypotension.
Hypotension is happening due to what?
Hypovolemic shock.
Good.
You see? It's not easy. It's not difficult, was it?
It's not easy.
It's not difficult. You just need to think about it.
So,
Okay.
other than hypovolemic shock, what kinds of shocks also can require ventilated assistance?
Severe sepsis.
Mm.
Septic shock.
What
What
else?
else?
Mm. Go ahead.
What other kind of shock?
Anaphylactic shock.
Anaphylactic shock.
Okay, away from shocks. And we said we have 4 types of shocks. Anaphylactic, hypovolemic, septic, and neurogenic shock. Right? So any type of shock can require your patient to be on a mechanical ventilator, right? Okay, away from shocks. Away from respiratory arrest or cardiac arrest. What else you would put your patient on mechanical ventilator to treat it? Is the respiratory arrest the only respiratory reason?
No.
What else?
Pulmonary edema.
Pulmonary edema, like يعني شوي a little bit of crackles in the lower lobes. You put the patient on mechanical ventilator.
Severe pulmonary edema to remove the nothing. First we give non-invasive mechanical ventilator. If they not tolerate in this means, still they got desaturation and vitals are abnormal means we have to intubate, and before that we have level of conscious also decrease means we have to intubate this.
What else? If the patient has pneumothorax, would you consider mechanical ventilator? No? There's one lung that collapsed and is not moving and patient is not breathing.
That time.
So what is pneumothorax? What is pneumothorax?
Air collection in the pleural cavity.
Due to what? Why it happens? Okay, forget about the reason. When we have pneumothorax, what will happen to the lung affected?
It will compress the
Collapse.
collapse.
So, would you consider putting your patient on a mechanical ventilator or no? Why? I need to understand why, not because I said so.
To expand the lungs.
Would the lung be expanded with a mechanical ventilator? So is it a balloon that you are opening inside? So what is it?
The airflow to the lungs to be
This airflow, what do you call it? How do you give it? Through which parameter on the mechanical ventilator?
pressure support.
La?
Tidal water.
La? Do you remember what he asked you?
P.
What is PEEP?
Positive in expiratory
Pressure.
pressure.
This is also one of the questions that you did not answer. What are the parameters of the mechanical ventilator? Other than PEEP,
Tidal volume,
oxygen level,
oxygen level, FiO2, pressure support,
hold on. PEEP pressure, tidal volume,
FiO2,
FiO2,
next pressure support,
pressure support,
and modes like volume control mode, volume control mode, assisted mode, and pressure control mode. That mode settings.
Okay, alright. So those are 5 parameters. Do you know how to explain each one of them? What is tidal volume?
Tidal volume. The air enter into the lungs.
The volume of air that the mechanical ventilator is pushing towards the lung. The amount of air that is being exchanged between inhalation and exhalation done by the pressure, by the mechanical ventilator itself. Right? Okay. What is the normal tidal volume range?
500 to 800.
Yes, sir.
500 to 800, so 300 is low.
Excuse me, sir.
It's depend.
Are you sure of your answer? Yes or no?
Yes.
You're sure?
They would
Okay,
guess or they stamp the price list.
Okay. FiO2 is what?
Oxygen delivered to the patient.
Oh,
It's ranging to 30 to 100.
Did they sign the price list? When the price list was sent to MOPH, was it signed?
MOPH, PNS?
PNS?
Should be yes.
Mr.
Alfie,
Elfin wants a copy of it.
we sent it by email by that time, right?
He wants.
No, I mean I am making sure
I'm
that
sure
it is
because
signed
I
because we
know
sent it.
the last time we sent it, exactly.
Okay, I will count so that we make sure it's on the laptop. 5 parameters, I need them to be listed when I come back. Okay, we will check the email and come back to you, okay? And I need to know the modes. Yara, come here.
Yes, I'm coming.
Are you stopping?